Okay, so we're going to talk about costochondritis today. Now, what is costochondritis? Inflammation in a part. Now, what is this part? Okay, so your ribs are connected to your breastbone. Okay, this is known as sternum, and your ribs are connected here. So that connection, if you're having inflammation there, that is known as costochondritis. Itis means inflammation. Now, what is the cause of inflammation in the first place? We do not know. Maybe some viral infection or some trauma, or somebody has hit you, you got a punch, or you are sleeping, having something inside your chest, or like having a locket or something that can cause costochondritis. Now, the exact cause, we do not know what is the exact cause. Now, how do you know that you're having costochondritis? See, it is very difficult to say you're having costochondritis. It is mostly done by the clinical judgment, because whenever you're having costochondritis, the symptoms you're going to get is very similar to having a heart attack. You'll be having chest pain. Okay, whenever you take a deep breath, you will be having a chest pain. You'll feel there is a squeezing type of pain. Yes, this pain can also relate towards your jaw and this thing. So in this thing, the patient gets really worried, and they immediately rush to the ER and just to make sure that there is no heart attack or something. Now, yes, that's very important. Anytime you're having any symptoms, it's always better to go and get it checked out by a physician or a doctor. Okay, you don't want to take a chance. So whenever you go to your ER, you do your ECG report will be normal. And mind you, whenever you're having a heart attack, the ECG report can be normal up to several hours. So that's why we do serial ECG report. Along with this, we will also do 2D echocardiography. Along with this, we'll do cardio biomarkers. Cardiac enzymes will be elevated if you're having a cardiac myocardial infarction, that is heart attack. So if I'm having costochondritis, all these things will be normal. You might do a chest x-ray, will be normal. Okay, if you want to do a CT scan, MRI, it's not going to work out. Everything is going to be normal. Okay, so just try to understand how do you approach the case of costochondritis. It's more of, I'll say it's more of diagnosis of exclusion. You rule out other causes, and then you come up to, yes, it is costochondritis. Okay, so remember, whenever you're doing a chest x-ray, because it's a cartilage. Okay, this cartilage is generally used in plastic surgery, and if you are doing some job with your reconstruction of your ear or reconstruction of your nose. Okay, that time you use that cartilage. Now, for that case, we use that cartilage. Now, cartilage does not appear very clearly in an x-ray, so it is difficult for you to make out if there is inflammation in the process of an x-ray. Okay, so if you do all this test, everything will be finding out normal. Now, if you physical examine the patient, you see the skin will be normal. Okay, the muscles will be normal. Now, when you press the area, there will be pain. Okay, there will be pain. And tell the patient to take a deep breath. Whenever the patient takes a deep breath, there's a very sharp stabbing pain. Or especially when the patient starts to cough or patient starts to sneeze, it's very severely painful. This is a very key point. Okay, so you need to see this. This can be unilateral or bilateral, and generally affects more than one rib. Okay, more than one rib is generally affected. It is more commonly seen in patients who are female and the age is around 40 years or more. And slowly the treatment here, it comes by itself and goes by itself. It should be fine within 1 week or 10 days. The pain should come down, right? So what is the treatment generally we give if you're having costochondritis? So remember, if you're having costochondritis, we'll give you some NSAIDs. Okay, we will give you some ibuprofen, or we'll give you some okay, whenever you're giving an ibuprofen, that is NSAIDs, please remember, whenever you're taking any kind of painkillers or this, you have to take PPI, that is to reduce the acid in your stomach, because whenever you're taking NSAIDs, the prostaglandin is reduced. Now, what is this prostaglandin? This prostaglandin is actually protecting your stomach, protecting the inner wall of your stomach from the acid. So if you are reducing the prostaglandin, your stomach is more vulnerable to the acid which is already present in the stomach. This is the reason if you're taking NSAIDs for a long time, you're having peptic ulcer. So you never ever take prostaglandin NSAIDs without as a medication that reduces the acid. That is, we generally use PPI. Okay, generally I use pantoprazole. Very important, this thing. And never ever take in an empty stomach. You have to eat something and then you have to take the medication, or else it is very harsh for your stomach. Okay, and another thing you might have seen, what is the effect of NSAIDs in the kidney. So How does the kidney filters the blood? The most important function of the kidney is to filter blood, to clean the blood. So the blood which is supposed to be clean comes to the kidney. So that blood vessel is known as afferent arteriole, A, alphabet A, afferent arteriole. Now this prostaglandin, what it does, it actually works on the afferent arteriole and it actually dilates it. So more amount of blood comes. More amount of blood comes. Now this blood, it there's something known as Bowman's capsule. It enters the kidney, and while going out of the kidney, it goes out by another blood vessel known as efferent arteriole, alphabet E, elephant, efferent arteriole. But remember, the diameter of the efferent arteriole is less, so more amount of blood coming and less amount of blood going. So there's a pressure generated here. So this pressure generated is known as pressure gradient. So this pressure itself causes the blood to get filtered. Now, if I'm taking NSAIDs, so the prostaglandins are reduced, so less amount of blood is coming to my kidney. Okay, so filtration is reduced. And remember, whenever less amount of fluid, whenever there's shock or less amount of blood going to the kidney thinks that you are in a state of stress. Then it starts a chain of process, RAS activation. What it does, it starts to conserve amount of fluid and reduce the amount of urine output. So your blood pressure starts to go up. This is very, very, very important. Okay, so that's the reason NSAIDs will damage your kidney and will damage your stomach, right? So even in cases of shock, so whenever this is protective mechanism, whenever there's huge amount of blood lost, that means less amount of blood is going to the kidney thinks, okay, I'm in stress. It immediately activates a RAS pathway and starts to increase the blood pressure. So it will start to retain the sodium, retain the urine. Okay, so whenever the sodium is there, the water will follow through. So this is very important. So basic treatment is just relax, know that there's no other causes. What are other causes of chest pain over here? Most likely you might be having a peptic ulcer, right? If you're taking some pain medication for peptic ulcer and the pain reduces after taking the medication for peptic ulcer, yes, it's peptic ulcer, right? Or if your heart is perfectly fine, yes, you're fine. If you're suspecting tuberculosis in the patient, yes, low social economic status, overcrowding, low immunity, okay, staying in developing countries or South Asian countries, you'll be having chest pain. If you're coughing out blood, there is blood mixed in your sputum, you're having night sweats, you're having weight loss, you're having weakness. So this suggests that you're having tuberculosis, symptoms of tuberculosis. Now if you're having cancer, yes, you can have cancer, okay, but the chances are rare, less common for our age group. Okay, if a huge amount of exposure to smoking and huge amount of exposure to pollutants and microparticles, right, asbestosis, and this thing will slowly go and damage your lungs, right? Silica dust, very dangerous. So this will happen in couple of years, not just 1-2 months. It will take around 15 to 20 years to develop all this manifestation. So you have to understand, you need to rule out all these things, then you come to yes, costochondritis is the cause. Okay, and general physiotherapy, chest exercise can be done. If all these things fails, then we go for surgery. What is the surgery? We just given steroid injection in the area, so it helps reduce the inflammation. So overall, if you're 40 years or more, female, okay, all the other causes have been ruled out. No history of myocardial infarction, heart attack, okay, there's no problem in their lungs, okay, they are not having peptic ulcer, and no history of trauma, right? So, and you rule out all these causes, then you can say yes, you're having costochondritis. Now very important, if you press, tenderness, how do you make diagnosis? You press, you will have tenderness. Okay, you tell the person to cough or sneeze, very severe pain. Okay, and then if you see other structures will be normal, you do the lab report, you do the chest x-ray, you do the ECG, you do the MRI, 2D echo, everything will be normal. Then you narrow it down to yes, costochondritis. And treatment again at all is NSAIDs. Make sure you are taking with pantoprazole, PPI, and never in empty stomach. Eat and do not abuse painkillers. This is don't abuse. If you're having certain amount of pain, try to endure it. If you can't, then go for painkillers. Just having a little bit of headache, don't take painkillers. It is not good for your health. Slowly it's going to damage you. and your pain endurance level will come down. So it's very important that do not abuse painkillers. You're having pain, of course painkillers are there, man. Painkillers are there to manage pain, but you need to make the threshold that you're not able to sleep, you're not able to work, you're not able to concentrate. That level you should go for the painkillers. Just a little bit of pain, mild discomfort, no, don't go for it. A little bit of headache, no. But in this costochondritis, yes, the pain is severe. In this case, you have to take the painkillers. Okay. So again, don't abuse painkillers and don't abuse steroids. Yeah, that's all. Thank you.